Hello, I am Dr. Frank Palermo. Good evening. Thank you for being here. The presentation this evening is on EEG and cortical P300 evoked responses. It is a very fast technique to evaluate TBI physiology pre and post intervention. Disclosures, I'm on the faculty of the University of Colorado's Rehab Department as a clinical assistant professor and the medical director of WAVI, a corporation that makes EEG systems in Boulder, Colorado. So today we are going to discuss youth sports and injuries. And now the youth are just so darn cute when they start out, but boy, once they get a little bit more aggressive and older, the head injuries abound, as we all know. Now, I've been a medical doc for about 40 years, as you can probably see, and I started out in 1980 as a sports medicine physician at the University of Washington. The first play of the first game that I covered had their star player sustain a concussion. I spent the whole rest of the game trying to argue with the coach not to put the player back in. Fortunately, he did very well in life and actually became the quarterback for the New England Patriots. Talk about concussions. Anyway, following that, we started looking at more objective ways of determining whether or not the physician could use more than neuropsych tests, more than the impact test, more than the SCAT-3 in order to produce objective measurements of the patient's clinical function, brain function, and also the change that's going on. So with today's technology, computers are much faster than they have been in the past. They're much more powerful, and the algorithms are quite strong and now adapted to EEG and cortical comprehension analysis, that portion of physiology. So you can get a $5,000 or more SPECT scan, as demonstrated on this slide, or you can use this EEG rapid system for about $50 per test. It's very easy to apply, and the results have been quite impressive. So the next slide shows a typical MTBI, or concussion, case presentation. We have a baseline analysis showing an increased activity in the parietal region where one would expect, but immediately post-concussion. Now, when I say immediately, it takes about 12 to 24 hours for the physiology of the brain to come back down to well below the baseline activity. The reason for that is that there's a huge surge in neurotransmitters, especially norepinephrine, that keep the brain activity heightened for a while, but within 12 hours, everything is either back to baseline and or significantly below. And what we have shown is that invariably, all true concussions have shown not just one standard deviation, but at least 4 standard deviations of a reduction in the amplitude of the P300 cortical evoked response. Now, patients or athletes are expected to be able to return to play in about 1 week and 3 to 4 weeks at the most. So we can track the brain activity, and what we have shown is that even though the patient's activity functionally have improved to the point where they can pass all the tests, pass the impact and SCAT tests, their balance is fine, they're not having headaches, in about 30% of the cases, the EEG evoked response does not actually get back to within 1 or 2 standard deviations. So there's some lag in brain activity compared to functional output. Then later on at the end of the season, we retest them, and furthermore, in many cases, we're able to re-evaluate the patients at the beginning of the following season. As you can see here on the presentation, it's a very easy documented test. Now, these are topograms. Topogram is a colored picture which represents voltages of the evoked response. Now, how do you generate them? So what we do is we have a very, very easy 5-minute setup of the EEG and headset combined. That generates an EEG output. We then add auditory oddball evoked response testing, which is a paradigm that gives you about 5 to 10 common tones. So the beeps are very consistent, monotone, and then occasionally you'll hear a very high-pitched tone, and that high-pitched tone is your key to respond. So the response would be picked up in that small 300 millisecond period of time after the oddball tone is elicited. So the next slide demonstrates the EEG montage set up on the head. Now, all we're saying is that each dot on the slide and each electrode on the scalp correspond to a different EEG note. But the evoked responses are elicited by the computer from the EEG data and demonstrated on the far right. Those are amplitudes in the range here of about 4 up to 13 or 15. So if you look at that and then you translate it into a topogram, you'll have the color picture that we showed before. Now, one caveat, anytime you do EEGs, you certainly end up with artifacting. Now, artifacting can take hours. However, with computer processing of today, we're able to hit a switch and it automatically artifacts, and you get the elimination of aberrant EEG signals within 1 or 2 seconds. So if you look at the picture here, you can see on the right each one of the contact points of the electrodes on the scalp, and you can see if they're green, they have good contact. If they're red, it is off. And if you look at the left, you can see where the red lines on the EEG output are eliminated, because if they're red, we just throw them out. Anyway, so that's an easy system. Again, because of more modern technology, we're able to come up with a process that 10 years ago would have taken 3 hours, and today it's instantaneous. Now, so here's the P300 amplitudes on the left, as we described, extracted from the head and the scalp, and so then you look to the right, and you'll notice that these are 3 different players. Their EEGs and their topograms are not the same, but they're within limits within age groups. So, but each one of them, although they're a little bit different to start with, all come crashing down after the concussion, as you can see. And then as they return to play on the far right, you can see that they increase. In fact, some of them have an increase in the amount of activity. However, that's relatively within one standard deviation. And if they have been exercising, if they have been attending class, and you might expect their brain activity to actually be increased from the level that it had been at preseason while they're on summer vacation. Okay, so the use of P300 evoked responses in traumatic brain injury rehab. So we can demonstrate brain activity within weeks rather than months. In other words, when we do rehab, we may give a patient a series of exercises, assistance with speech-language pathology, OT, PT, self-exercise, better sleep, and all the things we can throw at a patient, plus maybe a little bit of amantadine, and say, oh, the patient is making some progress, so maybe in a couple of months we'll be able to see some progress. But in a couple of months, if the progress isn't there, we're saying, oh my God, you know, we have to shift tracks. Well, if you had a decent physiology test that was easily applied, and you could, you know, not spend thousands of dollars retesting the patient for brain physiology, you can actually track them quite easily, and so that's what we've been able to do. It has been interesting to me to see patients' physiology increasing without, in fact, their function improving, at least for the first few months, and then the function catches up. Now, in the past, we often would have stopped the therapy on the patients because we're saying you've reached a plateau. The patients and the families hate this, and therapists feel that their efforts have not been as effective as expected. But in fact, what's been going on is that the brain has been reformatting itself and consolidating the new knowledge that it's created. So that's how we use this. We can also use it for adults. We can use it for cognitive decline analysis, depression, PTSD, wellness, and even in children, it's been used for analysis of ADHD, but then you can show that there's an improvement in ADHD. Okay, so let's get back to our testing that we did at the University of Colorado over the past 5 years. We had 348 players baselined, and of those, many of them were retested. So we actually have a total of 418 tests performed. 158 were from NCAA football, 142 were from high school football, 28 from women's soccer team at CU, and 20 from junior hockey. Retesting of them all were amounted to 70 total tests. So the next slide shows a P300 voltage drop post-concussion. Now, if a person was baselined and we thought there was a concussion, but there really was not. In other words, we thought he was clinically concussed, but we could not find any additional physiologic changes. We did not see a change on the EEG. However, if they were concussed, there was a profound change, again, approximately 4 standard deviations below where the patient started out in baseline. Return to play, they show an improvement in their brain physiology, but not everyone does. So some of them were functionally improved, but physiologically questionable. We don't 100% know what this means at this point. We'd like to have much more data so that we can use computer algorithms again to determine the increase in functional activity of the brain as it pertains to functional improvement. Furthermore, if we are able to track the patients over a long term, we can also use this to predict any kind of secondary deficits they may have in the long term. This slide shows an analysis of the concussion groups. We had 56 suspected events, with 44 actually showing significant change. The others actually showed no EEG changes, nor did they show any deficits from a functional standpoint or from a cognitive testing standpoint. So we did have 44 true concussion events. There were 35 players involved in this, which means that some of them had repeat concussions. And in fact, those athletes that did not show a progressive improvement in their EEG back to baseline prior to return to play, and even at the end of the season, were the first to demonstrate concussions, and their susceptibility was different from the rest of the group. All right, next slide demonstrates the statistics between the groups, and as you can see, with a p-value of less than 0.001, we were able to show a difference between the concussed group compared with baseline, as well as a difference between the return to play groups, even compared to baseline. However, they all returned to baseline by the end of the season and by the early next season. We did not see a change in the speed of the evoked response. So my demonstration was to show, as you can see in this picture, on EEG headsets, coupled with an electronic processing unit and a computer and simple disposable electrodes, that the system is easy to apply, not very complicated, doesn't take up a lot of space, and is very robust in what it can determine from brain physiology and repeat it easily if there is an injury or need. Furthermore, we certainly can use this in rehabilitation of TBI patients in the long term. So thank you for your attention. I'll take any questions that you may have. Thank you.